Mr. Thomas, my name is Juliana and I'm going to be your nurse today. Can we start off by identifying your name and date of birth?
My name's Drew Thomas and my birthday is 10/14/36.
Awesome. Alright, so today we have orders to put in a urinary catheter. And the purpose for doing that is because you're not emptying your bladder completely and that's going to put you at risk for infections. And we don't want that. So we're going to start off by just lowering your blanket a little bit. We're also going to raise your bed just so that you're in a really comfortable position for this procedure. Alright. Even though I'm taking the blanket and sheets down, I'm going to put this towel down just so that you have some sort of privacy. Do you have any allergies? Are you allergic to iodine, or betadine, or latex?
No.
Alright. I'm having trouble putting these on. Alright, so the first thing that we're going to do is we're going to give you some perineal care just to make sure that you're clean down there for this procedure. We're going to use some warm water and just a washcloth. I'm going to raise your down a little bit, but this towel's going to be there just so that you have some privacy. Okay. So I'm going to clean by doing circular motions, starting from the urinary meatus and working my way up. Alright, cover you back up. So this is a sterile procedure, and what we're going to use today is called a fully catheter kit, and it's completely sterile, so just don't reach down here and touch anything or the sterile field is going to be broken. Sterile field would also be broken if, when I'm putting my sterile gloves on, if my hands go below my waist. Just gonna lift this up a little bit. Now I'm going to put this down, and what this is, it's waterproof in case there's any spills, like that betadine. And I'm going to put this over you just so you don't get anything on you. Okay. Alright, now I'm going to put some sterile gloves on. Okay. Alright, so I'm going to move all this up now that I have sterile gloves on and I'm not breaking the sterile field. I'm going to move this towel up just a little bit as well. Alright, so first we're going to start off with cleaning you with some betadine just to make sure that there's no risk of infection. We're going to also do this like we did with the washcloth and go in circular motions from the urinary meatus. we are going to insert some lubricant just so that the catheter goes in as smooth as it can. So I'm going to insert that to your urethra. Alright. So next what we're going to do is we're going to insert the tube. You're going to feel some pressure but not really much pain, but let me know if you have any discomfort. Right, and that's the worst of it. So next what we're going to do is we're going to inflate the balloon that's on the inside of your catheter, that way that it doesn't come out. It stays inside your bladder. You do want to avoid pulling it because it could cause some damage if you do pull it out. Okay. Now that the balloon has been blown up, we're going to pull some slack so it's as comfortable as it can be. We're going to go ahead and tear this a little so we can get it off. Now what we're going to do is we're going to go ahead and tape this to your abdomen, that way that you can ambulate without feeling uncomfortable or having any discomfort. Make sure it's really nice and secure. All right. So next what we're going to do is we're going to go ahead and take a sample from your bag. And we're not going to clamp it because since it just was inserted, it's going to be fresh, clean urine that hasn't been sitting. Then we're going to send this off to the lab. Your urine is a pale yellow and it doesn't have any smell, nor is it cloudy, which could be infection, so you are infection free. So I'm going to go ahead and send it off to the lab. Do you have any discomfort or any questions about the procedure that I can answer for you right now?
No.
Do you have any discomfort?
No.
Alright. Before I go, I'm going to go ahead and put clean gloves on, and I'm going to clean you again, just to get the betadine off, and that way it doesn't cause any skin irritation. I'm going to do that again with some more water and a washcloth. Also going to clean this a little bit. You have any questions that I can answer for you before I go?
No.
Alright. Now if you do need to get up and use the restroom or you need help getting out of bed, the call light's in reach, and I'm going to go ahead and put you in the lowest position with your bed rails up. This bed is really slow and very hard.
It's okay.
Alright, so again, you have the call light here and you have a call light here, and if you need me, just press it and I'll be back as soon as I can. Hi, Mr. Thomas. My name is Lana, and I have orders to remove your urinary catheter today. So first, I'm going to start off with putting some gloves on because I'm going to go ahead and empty out your catheter bag. Go ahead and I'm gonna move you back up. That way you're comfortable and not really open it. It's gonna go a lot quicker than your insertion did. So down part. Do you have any allergies to latex, betadine, or iodine?
No.
Just want to make sure before I use latex gloves on you. Alright. So the procedure is a lot like when I'm inserting it, as in I'm going to give you some privacy. We're going to make you as comfortable as you can be. Go ahead and get that syringe. So I'm going to go ahead and lift up your gown. Alright. So what I'm going to do is that water that it inserts below your balloon, I'm going to go ahead and attach the syringe. And I'm going to let it refill on its own. It's just going to take the water out and the balloon's going to deflate. And while I do that, I'm going to take this tape off of you. Do you feel any pain or discomfort right now?
No.
Okay. Go to here. And that's all that I'm going to get out of there. So I'm going to just take a deep breath. And it's out. So that's the worst of it. Okay. And before I go, I'm going to clean you up a little bit. Just make sure you don't have any lubricant. You are good to go. Do you have any questions for me?
No.
Alright. Go ahead and lower you back down. Alright, if you need anything, hit your call. You have one here and you have here, and I will come back as soon as I can.